So I'm going to start with the key study because this is what they will ask you about in the most detail. Quickly, just a little bit of background. Remember, virtual reality had been used pretty extensively in psychology to do things like to treat phobias, exposure therapy. They found that treating people for things like public speaking and fear of heights was very effective in virtual reality. In particular, so like if I want to be treated for a phobia of heights, it may not be very practical for my therapist to accompany me to a bridge and help me to work my way slowly through that fear hierarchy. But being able to do it in a situation like this that feels real is a lot easier for therapists and patients. Something like public speaking. Otherwise, how would you do this in vivo? You'd have to get a bunch of people to stand there. That would be difficult to tackle with your therapist. Whereas if you can do it in virtual reality, and it's neat because you can you can turn up the crowd from really engaged and friendly, which would obviously be lower on that fear hierarchy, to the point where they become less interested, like a more difficult crowd to a hostile crowd. And it's really easy to standardize, and it's very easy to control in a way that you would never be able to if you were doing in vivo exposure. So VR in psychology had already been widely used before Freeman's study. Remember these terms that are crucial to schizophrenia. The aims in this study that he pretty much spells out: one, to examine whether individuals have persecutory thoughts about virtual reality characters under controlled conditions. We remember that these people are non-clinical. They're participants without a history of mental illness. I'm reading you various parts of the study. To investigate whether avatars can trigger persecutory ideation. And then to find out whether there are cognitive or emotional factors that predict the likelihood that someone will show persecutory ideation. The hypothesis, of course, we predicted that a small proportion of individuals would experience thoughts of persecutory content in a neutral virtual environment, and these individuals would have higher levels of trait paranoia and emotional distress than individuals who did not have the persecutory thoughts. So that was that hypothesis. The sample, you may remember, there were 24. They were evenly divided between males and females. Their mean age was 26. We are told that they were recruited via advertising within the University College of London. And like I said, they were non-clinical. They had no history of mental illness. We are told that they were paid for their participation. There's no other details, but they were paid for their participation. And then the males and the females were balanced between two of the conditions. Remember, there's really only one thing that gets manipulated method-wise. One of the things that is manipulated is half of the participants did the questionnaires before and after their VR experience, and the other half did it only after. Remember, the concern was that doing the questionnaires might prime them to experience paranoia. So they wanted to account for that by having half of them take the questionnaires before and after, and the other half took them only after. So that's the only thing that's really manipulated as a condition. Otherwise, they went in and experienced the exact same neutral library scene. We are also told explicitly that consent was obtained for the participation, but again, to prevent priming, they were not informed that the study was specifically about persecutory thoughts. You remember that what the scene looked like. There were 3 individuals at one table and 2 individuals at another table. It was designed to look like a library because this was a university population, but it was never explicitly referred to as a library. I mean, obviously it seems obvious that that's what they would have, it would have inferred seeing it, but it was never explicitly referred to as a library. They were told, this is the kind of detail I feel like they would ask you about. They were told, please explore the room and try to form some impression of what you think about the people in the room and what they think about you. Like I said, it was a lab experiment in that one respect that the way that that was manipulated. They were trained to use the VR equipment, and then they entered it and they spent 5 minutes in there. Their behavior was described as ambiguous, things like smiling, looking, and talking to each other. There was nothing overtly hostile done by the avatars. Their behavior was deliberately ambiguous. The other part of it, of course, was all of the questionnaires that they had them take. So they had them take something called the brief symptom inventory. There's just so many, like, I guess they could ask you all of these, like the details about all of these, and I'll tell you some of the details about all of these, but that's overwhelming to memorize what the, there's 53 items on the BSI. We'll look at that one, but like they took 5 different questionnaires. So I can't imagine they're going to ask you for specific details about the number of items and the rating scales for each of these, but I'll run through them real quickly. The BSI is this like kind of super questionnaire, which assesses you on a bunch of different things. It assesses obsessive compulsive, interpersonal sensitivity, anxiety, depression, hostility, phobic anxiety, paranoid ideation, psychoticism, and somatization. Somatization is when you experience psychological distress or emotional pain and you start to feel it as physical symptoms. If you've ever heard, you probably haven't, but they would say something like, oh, this is psychosomatic. If I went to my doctor and I said, like, I'm having these intense pains, and there was no physical cause for that pain that they could find, they would say it's psychosomatic. It is a psychological or an emotional pain that's manifesting as a physical symptom. So that's somatization. So the BSI gives you kind of this like super score for 9 different big things. Obviously, the ones that are most relevant to us are anxiety, paranoia, and interpersonal sensitivity, because those are the things that ultimately end up being either were hypothesized or end up being the traits that are correlated with experiencing persecutory ideation in VR. They also gave something called the Spielberger State Anxiety Questionnaire. The purpose of this was to see if people's anxiety changed between before and after. And I'll tell you the result to that in a minute. There was a paranoia scale. The paranoia scale was created by Fenigstein and Venable. It's 20 items, and it was designed originally to measure paranoia in college students. It assesses paranoia related to persecution and paranoia related to reference. It's one where scores go from 20 to 100. But that's paranoia, that's general paranoia. They also gave them a sense of presence questionnaire. The sense of presence questionnaire, the whole point of it was to be able to tell whether or not they really felt they were part of the virtual world. Did they really have a sense that they were being there? Did they have a sense that they had really visited this library rather than just seeing pictures of it? And did the virtual world dominate their behavior, or was it were they still mentally in that in the real world? This one is 6 questions on a scale of 1 to 7. But the one I would guess they might ask you about is the VR persecution questionnaire, because that is the one that was written by the named author. So Freeman ended up writing this questionnaire because there wasn't one that specifically measured persecution in virtual reality. We're going to look at that one and talk more about that one, because if they were going to ask you for details, it would be about that one. Then in addition to all that, they also conducted semi-structured interviews after the participants came out. The goal of those was to get their spontaneous impressions of that virtual environment and give them the chance to report any distress they were feeling. They videotaped the interview, and then they had the semi-structured interview. They rated the people on a 6-point scale for persecution. They were rated by the named author. Again, that's Freeman, because he is a clinical psychologist. So he watched the videotapes and gave them a rating for how much they gave the impression of persecution. So all of that is paired with, so then they look at the results of all of these and they compare it to the experience that the people had in the library scene. These are just the list of things that the BSI assesses. Our most important results, most of the Ps had positive opinions about the avatars, but there were some ideas of persecution. If you look at this summary, we're actually going to look at this first. So let's talk about the VR paranoia questionnaire. The first 5 questions are assessing feelings of persecution. So if you look at those first 5, you can see that. 6 through 10, those are assessing feelings of reference. So reference, remember, is the idea that something is related to you. I didn't want to say refers to you. So schizophrenics who feel that like the TV is talking about them when they're not, it's not about them, but the TV's talking about them. In this library scene, it would be, they were talking about me behind my back. They were saying negative things about me to each other. They were watching me. They were looking at me critically. That's the reference part. Persecution, those ones are where they like want to hurt me or want to harm me. Then the last 5 were positive. So they looked at the mean score for each of these areas. And then I'll go back to here for a second. The highest mean score was 6. Now, each of these is rated, each of these items they answer on a 4-point scale, 0 to 3. So the max score that you could get in the persecution sub-score, 1 through 5, the max score you could get would be 15, obviously. The max score you could get on the reference section is 15. The max score you could get on the positive section is 15. So you can see that the highest mean was for the positive part. Their scores ranged from 0 to 13. So someone got a 0 in this section and someone got a 13 in this section, the positive section, but the highest mean is for positive. So most people had positive opinions about the avatars, but some people did experience feelings of persecution and reference. You can see that there. Here's some quotes from people. Each of these is from a different participant, but they have in the past asked on the exam for specific items from the VR paranoia questionnaire. So make sure you commit at least a couple of these items to memory. Not surprisingly, when they correlated their VR persecution subscore, it was positively correlated with the VR reference. So there, it makes sense that somebody who scored high in the first 5 in VR persecution would also score high in 6 through 10 in VR reference. And it was negatively correlated with the positive. So it makes sense that somebody who scored higher on the VR persecution section would score much lower on the VR positive section. So you have a negative correlation between those two, just in case they were to ask you that. This number can't be right for the correlation. Correlations range from 0 to 1. So 0 was there was absolutely no link between the two variables, and 1 is there was a completely positive correlation, and -1 would be a completely negative correlation. So for everything you said yes to, you said no to, would be a completely negative correlation. So I don't know if this is a typo, but anyway, that's what you can't have a correlation of -536, but that's what they say that's what the study says. The author Freeman comments that he was surprised that this measure didn't already exist, that there wasn't like a validated measure for paranoia in virtual reality. So they designed it themselves, and he says he designed it to have high face validity. Remember, face validity is to what extent is it actually testing the thing that it's supposed to test. So they went into, there was a definition of persecutory delusions, and they like just pulled the items out of there. So they made sure that these items were obviously definite persecutory content. One thing about this is there was a high correlation between how people scored on the VR paranoia questionnaire and the ratings given to them based on the interview. So that makes sense too. And that's a good sign for the validity of this questionnaire, because they wrote this themselves, so they don't have they need to test it against other things to make sure that it's valid, that it has concurrent validity. But for one, people who scored high on the paranoia questionnaire also scored high on the persecution assessment by the observer. Some other quick results: they did not find any significant difference between males and females, or between those who had the questionnaire before and after versus only after, because remember they did that because with a concern about priming. People did have a moderate sense of presence. The sense of presence is rated from 1 to 6. The mean was 2.3. So they did moderately feel that they were there. And then based on the state anxiety questionnaire, people did not seem to experience increased anxiety based on going into VR. In fact, there was a slight decrease in anxiety. The pre-test mean was 34.79 for the anxiety, and then the post-test mean was 31.82. So they actually seemed to like reduce in anxiety. So there was no, the VR experience itself did not seem to increase their anxiety. Going back to their aims, and then the conclusion there in yellow, yes, people without a history of mental illness do experience thoughts of persecutory nature, a small number of them. People do attribute mental states to VR characters. They do think that computer-generated characters have intentions toward them. And then as far as factors that predict the likelihood that you will show that, remember, they expected it to be paranoia and emotional distress. But it was not. There was not a significant correlation between how they scored on the paranoia section, or the paranoia part of the BSI. But the ones that were predictive factors were anxiety and interpersonal sensitivity. And when they did a regressive analysis, interpersonal sensitivity was the most significant. Just so you have a definition of what interpersonal sensitivity is, because that, again, feels like something they might ask. Interpersonal sensitivity has to do with your own feelings of personal inadequacy and inferiority. It's correlated with feelings of self-deprecation, like tearing yourself down or deprecating yourself, and feelings of self-doubt. So then that is the thing that seems to be most significantly correlated with whether or not you'll experience feelings of persecutory ideation in VR. People with interpersonal sensitivity also seem to show acute self-consciousness, and also negative expectations concerning interactions with others and others' perceptions of them. So you can see how that might lend itself to experiencing persecution, because you're like highly sensitive about how your interactions with other people are and how other people are going to feel about you already. So for that reason, that may prime you to experience those feelings of persecutory ideation. This all fits into a larger like hypothetical model that Freeman he postulated. This is consistent with our theoretical model that postulates that emotional processes contribute directly to the development of persecutory thoughts. And then in the discussion section, he connects it to other research findings. Martin and Penn found that did a study of paranoia in students and found that paranoia was associated with depressed mood, social anxiety, and avoidance, and lower self-esteem. So we see, again, that emotional processes contribute to the development of sometimes disorders like persecutory thoughts or depression. Another one found that people who go on to develop schizophrenia have higher levels of anxiety, interpersonal sensitivity, and social isolation in childhood. Another study found a significant connection between interpersonal sensitivity and paranoia. There was a high correlation between submissive behavior and paranoid ideation and interpersonal sensitivity. There's a framework for this idea that emotional processes contribute to things like persecution and can contribute to other clinical the development of other like clinical symptoms as well. So this study fits into that larger framework, or that larger methodical framework. I'm not going to talk about these, but I do want you to look at them. In the end, he makes a bunch of suggestions for how this methodology could be used in the future. One thing he suggests is you can manipulate people's anxiety levels before they go into VR. Another thing he suggests is like exploring persecutory ideation in other environments like buses, street scenes. And then he also says that like in the future, this might be used clinically to assist patients to evaluate their persecutory thoughts and reduce them. Again, we need to treat like people with schizophrenia, because that's what this all connects to. People with schizophrenia, their symptoms are not going to go away completely. They're going even with successful treatment with antipsychotics, they're still going to experience some of these thoughts. So this can be a great way to give them like limited to really control the environment that they're in and help them learn those coping skills that will allow them to like evaluate. To remember, we talked about reality testing. One of the things you have to do is reality test your delusions. So this could be a great environment for them to reality test those feelings of persecutory ideation and eventually to reduce them. So all of that is like suggestions that Freeman makes for how this, for extensions of this study and how this methodology could be used in the future.